In many communities, access to basic primary health care can still feel out of reach. eLAJ Smart Clinic, an initiative by Biocon Foundation, the CSR arm of Biocon Group, brings quality care closer to people in the communities who need it the most. Established as one of the first technology-enabled primary healthcare models for marginalized communities, eLAJ was built with a dual purpose: to provide comprehensive primary care and to generate reliable digital medical records that support better treatment and help governments make data-driven public health decisions.
This is a community-centric model, and we have focused not only on clinic care but largely also on the communities. And so for us, it's been imperative that we reach out to people at a household level. This is also known as a population-based approach. And so it begins with a healthcare navigator. We train local people as healthcare navigators. They go to the households of people, be it in peri-urban areas, rural areas, urban, and even tribal regions, such as Uttara Kannada and Chamarajanagar. We have eLAJ clinics functional. And so once the healthcare navigators go at a household level, they assess them for a range of conditions. Their vitals are assessed, and if we find that some of their values are altered, for example, if they have higher blood pressure than normal or higher blood glucose levels than normal, then they are counseled, and our healthcare navigators make certain that they come to the nearest eLAJ center or to the nearest PHC, as the case may be. But once they come to the eLAJ clinic, then the patients are welcomed into a clean space, into a space where they're respected, and we make certain that the records of each and every patient who enters into our clinic is maintained. We have an electronic medical record system. Data entry operators take the data of the patient, enter it into the electronic medical record. They meet with the physician, and if the physician orders any lab test, we have a fully equipped lab, and these lab records are also integrated with the medical records. Now you may wonder why I'm placing so much emphasis on the medical record. It is because we insist on continuity of care, and continuity of care can only happen once we have previous records in place.
ಹೆಲ್ಪ್ ಆಗುತ್ತೆ ಮೇಡಮ್. ತಿಂಗಳ ಬಂದು ವೆಯ್ಟ್ ಚೆಕ್ ಮಾಡ್ತಾರೆ, ಪ್ಲಸ್ ಇದು BP ಚೆಕ್ ಮಾಡ್ತಾರೆ, ಮತ್ತು 3 ತಿಂಗಳಿಗೆ 6 ತಿಂಗಳಿಗೆ ಒಂದ್ಸಲ ಇದು ಚೆಕ್ ಮಾಡ್ತಾರೆ. ECG ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ ಬೇರೆ ಡಾಕ್ಟರ್ ಹತ್ರನೂ ಮಾತಾಡಿಸಿ ಹೇಳ್ತಾರೆ. ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ ಆಗಲಿ ಯಾವುದಾನ ಇದ್ದರೆ ಹೇಳಿ. BP, ಶುಗರು, NCD, ECG ಎಲ್ಲ ರೀತಿಯಾದ ಕಾಯಿಲೆಗಳನ್ನು ಇಲ್ಲಿ ಪರೀಕ್ಷೆ ಮಾಡ್ತಾ ಇರೋದ್ರಿಂದ ನಮಗೆ ಯಾವುದೇ ಒಂದು ಇದಕ್ಕೂ ಹೊರಗಡೆ ಹೋಗೋಣ ಅಂತ ಮನಸ್ಸೇ ಬರಲ್ಲ. ಏನೇ ಇದ್ರೇನು ಇಲ್ಲಿಗೆ ಆರೋಗ್ಯ ರಕ್ಷೆಗೆ ಬರೋಣ ಅನ್ನೋ ಒಂದು ಮನೋಭಾವ ನಮ್ಮಲ್ಲಿ ಇದೆ.
And therefore the emphasis of the eLAJ program has been to ensure that each patient visiting our clinics has access to his records, that the care is affordable, it is equitable, and it is quality-based care. And after this, of course, it's not the end. After the consultation, we insist that our healthcare workers follow up with each and every patient, insisting that they visit the clinic on scheduled days so that, their healthcare is maintained. So I would believe that this is one of the integral parts of the eLAJ program: the community connect, the access to quality care, and also the emphasis on continuity of care, so that each patient engages with their health metrics, and that they can make some lifestyle modifications or change in their medications much in advance, proactively, rather than months later.
ನನ್ನ ಹೆಸರು ಉಮಾ ಮೇಡಮ್. ಮನೆಯಲ್ಲಿ ಎನ್ನಗರದಿಂದ ಬಂದಿದ್ದೀನಿ. ಇಲ್ಲಿ ಒಂದು 10 ವರ್ಷದಿಂದ ಬರ್ತೀನಿ BP ಚೆಕಪ್ಗೆ. ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ ಡಾಕ್ಟ್ರೆಲ್ಲ, ಮತ್ತು ECG ಎಲ್ಲ ಮಾಡಿಸಿದ್ದೀನಿ. ತಿಂಗಳು ಚೆಕಪ್ಪು ಬರ್ತೀನಿ. ಮನೆಯಲ್ಲಿ 4 ಮೆಂಬರ್ಸ್ ಇದ್ದೀವಿ. ನಮ್ಮ ಮಗಳು ಅಳಿಯ, ನಮ್ಮ ಮಗ, ನಾವು
ಹೇಳ್ತೀವಿ ಮೇಡಮ್, ಇಲ್ಲಿದ್ದೇ ಹೋಗಿ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಪ್ರತಿ ತಿಂಗಳು ಒಂದ್ಸಲ ಕರೀತಾರೆ. ನಮಗೇನ ಇನ್ನೂ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಕೊಬೇಕಂದ್ರೆ ವಾರಕ್ಕೊಂದ್ಸಲ ಹೋಗಿ ಟೆಸ್ಟ್ ಮಾಡಿಸ್ಬೋದು. ಅದ್ರ ಬಗ್ಗೆ ಏನು ತೊಂದರೆ ಇಲ್ಲ. ನಮ್ಗೆ ಅನುಮಾನ ಬಂದರೆ ಚೆಕ್ ಮಾಡಿಸ್ಕೊಳ್ಳಿ, ಅವ್ರಿಗೆ ಏನು ಮಾಡ್ತಾರೆ ವಾರಕ್ಕೊಂದ್ಸಲ.
ಇಲ್ಲ ಹೇಳಿದ್ದಾರೆ, ವಾಕ್ ಮಾಡಬೇಕಂತ ಹೇಳಿದ್ದಾರೆ. ಊಟದಲ್ಲಿ ಎಣ್ಣೆ ಇದೆಲ್ಲ ಐಟಮ್ಸ್ ಎಲ್ಲ ಕಡಿಮೆ ತಿನ್ನಬೇಕು, ಜಿಡ್ಡ ಐಟಮ್ಸ್ ಎಲ್ಲ ಅಂತ ವಾಕ್ ಮಾಡಿ ಅಂತ ಹೇಳಿದ್ರೆ ವಾಕೆಲ್ಲ ಮಾಡ್ತೀನಿ ನಾನು. ಎಲ್ಲ ಊಟ ಎಲ್ಲ ಹಂಗೆ ಡಾಕ್ಟರ್ ಹೇಳ್ದಂಗೆ ಸ್ವಲ್ಪ ನಾನು ಕಂಟ್ರೋಲಾಗಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿದೆ. BP ನಾರ್ಮಲ್ ಇದೆ, ಚೆನ್ನಾಗಿ ಏನು ತೊಂದರೆ ಇಲ್ಲ, ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ.
Across 6 districts, eLAJ Smart Clinics operate through 11 clinics and 8 outreach teams, strengthening NCD care. Over 1 million patient visits, more than 3 lakh unique patients served, over 96,000 people screened for oral cancer,
At the heart of the eLAJ program, therefore, are our skilled healthcare workers, our data entry operators, lab technicians, and of course the physicians. They form the core of what we do.
eLAJ smart clinics are transforming primary healthcare one neighborhood at a time. By bringing trusted and free care closer to people, eLAJ is empowering communities to take better control of their health.